get started, I want to introduce you all to this space. So we have a kind of Afro-futuristic theme going today, just because I find that that inspires looking towards the future. We're going to talk a little bit about our past, we're going to talk a little bit about where we are now, but really this space is to instill a sense of hope and a sense of creativity around where we want to go. So along the wall, you will see what we call the Galaxy Gallery. So that is just a compilation of a few advocates, present and past, who identify as BIPOC and have made changes in addressing systemic racism in our world. We also have on the laptop, the Museum of Black Joy. So that's a virtual exhibit. You can feel free at any time to check that out as well. And the back corner that everyone was so excited about is what we call our little lounge space. So there are coloring books there. I think are there fidgets there? There's oils. Okay, yes. So if at any point you're like, I need a break, you can always go take a walk, or you can go back there, you can color, you can grab a sheet. Whatever works for you, this is your space today. So along this wall, we also have the parking lot. So I mentioned you can always ask questions verbally, but if you prefer to leave a question there, we'll get to that throughout the day. And then if you have any appreciations or gratitude, you can also leave a sticky note there. I think that's it. We also have a playlist that was inspired by our team and then other people that I work with as well. So I don't know how to send that out. Okay, if you want that, we'll get it to you. Okay, we can send it out. We'll play it during the break as well, but if you want the link, we'll make sure you get it as well. Thank you. Okay. So my name is Chante. I go by she, her, sis. I, by day, am an administrator. I work as a director of housing for Cook County Health in Chicago. I also have a private practice where I do therapy in the evenings. I also really like collaboration and community engagement. And I am a pet mom, so that's Simba. Today, I'm facilitating a space of healing. That's my hope. And I'm here to hype you all up, be a space. That's going to be my thing. I'm very human. This won't be the perfect presentation, so if you're looking for that, you're going to be disappointed. But I really want to create a space where we can connect with one another in a space that feels safe. And my favorite wellness activity right now is spending time outdoors. So, in your tables, if you want to take like a minute to just introduce yourself, maybe say where you're from, and your favorite wellness activity right now. All right. So, first of all, I love that we are already chatting. I mean, kudos to you all Monday morning to be so active already. So, I didn't get to hear where folks are from. So, where are people from? Can you yell out? Portland, Wyoming, Alaska, San Francisco, Sacramento, Seattle, Minneapolis, Denver, okay, New York, Baltimore, yes. Shortest distance, yes. Oh, okay, all right, awesome. Okay, raise your hand if this is your first National Healthcare for the Homeless Conference. Woo, all right, yes. All right, raise your hand if this is your second. Yes, okay. This is also my second, so there you go. Third. Yeah, okay, OGs. Anyone who's been here more than 4? Okay. Oh, you did the virtual one? Okay, that counts too. Okay, so anybody who's gone to more than 4 conferences? 4? Okay. All right, well, thank y'all. Thank you, everyone. I hope that this is a good start to the conference, since a lot of you are new. I can say from my experience last year, there's a lot to learn and a lot of great people to connect with. So I hope you have that experience as well. Okay. So I'm going to do a land and labor acknowledgement. Like I said, I'm from Chicago, and that is the ancestral homeland of the people of the Council of Three Fires, the Ojibwe, the Potawatomi, and Odawa, as well as the Menominee, Miami, and Ho-Chunk nations. It was a site of trade, travel, gathering, and healing for dozens of other Native tribes, and is still home to over 100,000 tribal members in the state of Illinois. The indigenous people's connection to this land has been challenged by the violence, disease, treaties, invading settlers, relocations, forced removals, reservation termination policies, and other colonial actions. However, throughout this turbulent history, this land has continued to hold great historical, spiritual, and personal significance for the original land stewards of this region. We also acknowledge the legacy of slavery in the United States and the enslaved African people whose labor was exploited for generations to help establish the economy of this country. An estimated 10 million enslaved Africans were forcibly brought to the Americas beginning in the 1500s until 1867, and was followed by a series of discriminatory and repressive laws that created a racial caste system that legitimized anti-Black racism. The legacy of slavery and the racist laws and practices that continue to be passed and implemented impact American culture and our institutions at every level. The labor of slaves built many of the civic and federal institutions with which we all interact with. The economics of the transatlantic slave trade and the exportation of cotton allowed the United States to position itself as a leader in global trade for centuries. Our nation continues to profit financially from the exploitation of the descendants of enslaved Africans. We acknowledge the harm that colonialism and white supremacy have brought to these lands, in particular the erasure of both First Americans and African identities via racist laws that segregated all peoples. By recognizing the land that was taken from First Americans and the forced labor that was provided by enslaved Africans and Black people, we strive to take steps towards creating a more equitable and just world for all of us. Okay. So the intention for today is to create a grounding space where we can discuss some of those things that were mentioned in that acknowledgement. We want to talk about systemic racism and trauma, how that impacts our physical and mental health as providers, as well as working with the individuals that we serve. I am also hoping that in this time, you will receive adaptable tools. So you each have a packet in front of you. Those are various worksheets that we will go through as a group, but you can also feel free to adapt those to working with your clients, patients as well. And we will also have an opportunity to build networks to continue to move towards social justice and transformative justice, particularly within the healthcare systems. So now that we've talked about the intentions, I think it's important for us to decide as a group what makes sense in terms of community agreements. So these are some initial thoughts I had. I'm going to give you all the opportunity to weigh in to see if there's anything else missing from here. So these agreements are brought about by four main values: authenticity, compassion, trust, and restoration. So authenticity, we honor the personal and sacred nature of the experiences, stories, and vulnerabilities shared in the collective, and welcome people to participate in a way that feels most authentic to themselves. So, as I mentioned, you can feel free to have a conversation with me. You can have conversations with each other. You can leave messages on the board. Whatever feels authentic to you to participate, that's the way we'd like for you to show up. Compassion. We listen with empathy and show compassion for ourselves and each other throughout our journey together. We come to this space without making assumptions about the journeys of others. So we have an openness here, and we are listening to one another from a place of understanding, and even if we don't understand, being compassionate towards one another. Trust, we come to the space with a sense of curiosity and an openness to explore, believing that it is likely that we will learn something new or discover something about ourselves and or our work. We look for ways to connect and empower each other as a collective. So throughout the day, we'll work on building trust, but I ask that you all trust yourselves in this process and come to it with a sense of curiosity and a goal in mind for yourself. And finally, restoration. We take time to create space to take care of ourselves and hold ourselves accountable to taking care of ourselves throughout our time together. If you need to do anything for you, please hold yourself accountable to doing that. Are there any other things we should add for this space? We're gonna be doing some of that. Thank you, absolutely. Just breathing, just being. Anything else? All right. Reach out. Yep. Yep. Okay. Yeah, and that kind of reminds me of maybe challenging yourself a little bit too, right? Sometimes we may not feel as comfortable always reaching out and taking that risk, but maybe a challenge today is I'll meet someone new. So maybe challenge yourself in a way that feels right for you. And Elena, can you take this mic just in case people want to speak and make sure everyone can hear? Thank you. Okay. All right, so we are visiting 3 planets. Please forgive the cheesiness of the titles here. So the first one is Wellness World. We'll be talking about wellness there. The second one is our Planet of Narratives. We'll be talking about narrative work and trauma. And the last one is the Collective, where we'll be talking about coalition building and advocacy. All right. So the first planet, Wellness World, we're going to talk about what is happening. So how many of you are direct service workers? Okay, majority. Okay. How many are administrators? Okay, all right. So I'm going to ask you to think about this both from the aspect of you personally, as well as either the clients you're working with or the staff you might be working with as well. Okay, so for each planet, I've designated a few key terms. These are very broad definitions, and that was intentional. So you may say, oh, this definition is missing something. Yes, they are, and that is up to us to determine here. So I just wanted to level set by starting with some very basic introductory terms here. So we're going to start with stress. So stress, a normal reaction the body has when changes occur, resulting in emotional and intellectual responses and physical ones. So short term could be something that lasts a short amount of time, right? It could last a few hours, it could last a day or so. Something short term may be, I have a deadline at the end of the day. Something chronic would be something that I continue to have to deal with over time. So it may be, from a job perspective, I am working to end homelessness for my county. That can be, depending on how I process that can be quite stressful and a very, very big goal. So part of stress is how we express it in terms of expectations around that. There's also a culture of stress, which is how we deal with showing up in spaces where our culture may be marginalized. A lot of immigrants experience this coming into this country, and that there is a need to adapt, but not always the acceptance of the other culture, right? So it's sometimes what'll happen is people will internalize that and say, well, my culture isn't right here. It doesn't fit. Therefore, I have to figure out how to fit here. And we not only see that with immigrant populations, but also with anyone. If you are someone, a person of color, going into an all-white organization, that can be stressful. So that is how we deal, that is the amount of stress that we're under based upon our culture feeling marginalized and the perception of that. So stress happens, but stress also propels us either towards burnout or towards wellness. So burnout is a syndrome that results from chronic stress. So if I don't address stress from the beginning and intervene, then over time it builds up. And because we only have so much energy, we burn out. I'm going to talk about Sojourner syndrome and the Superwoman schema in a little bit, but the opposite end of that is wellness, which is our pursuit of activities, choices, and lifestyles that lead to a state of holistic health. So this is when we hold ourselves accountable to taking care of all aspects of wellness, which we will talk about. We find that we can manage the stress in a way so that it doesn't become chronic and we move away from burnout. Is there anything that folks would add to these terms? Okay. We're getting a lot of stretching in today. So raise your hand if in the past week you have skipped a meal. All right, y'all make sure you eat today, okay? Yes, okay, so quite a few. Okay, what about slept less than 5 hours a night? Okay, all right. What about answered a work call after hours? Okay. What about thought about a patient or client for several hours after a session or appointment? Okay. What about talked about a work situation for several hours? You're just like, I'm just gonna keep my hand up right here. Yep, okay. What about experienced a microaggression? Wondered whether or not to call out racism among colleagues? And felt unappreciated. So I don't know if you all looked around, but a lot of folks raised their hand for a lot of these. And these are all aspects of stress that build up. So not being able to take care of our physical needs. Answering a work call after hours. So that speaks to boundaries being violated. Thought about a patient client for several hours after sessions appointments. That can speak to multiple different things. Talked about a work situation, same thing. We're still thinking about these things, therefore we're still accumulating stress around them. Same thing with experiencing a microaggression and wondering whether or not to call out racism among colleagues and feeling unappreciated. So the first three we'll talk a little bit about in this wellness planet. The next three we'll talk about in between wellness as well as narrative work. And then the last two we're gonna talk about in coalition building. So hopefully you all will be able to get an opportunity to really examine your own wellness plan and see if there are some tools that can help so that you don't feel like you have to do these things, on a regular basis. Okay, this one cut off a little bit, but it says stress, just look for me somewhere beyond the limits of human endurance. So this aspect is kind of speaking more to expectations. Stress in some ways can be helpful. If I know that I have something that I need to get done, but I have the resources to do it, and it feels feasible for me, then stress may not be as harmful. Now, if I'm giving unrealistic expectations, and it's a deadline that I cannot meet and I may not have the capacity to do it, then that's when stress becomes too much. So if, as a supervisor, that's something to consider. What is my team's capacity? And am I setting realistic expectations? I recognize that funders have interesting expectations, and sometimes as leaders we have to advocate and say, this is what we know, right? We're the experts here. We know this is not feasible. And that's really important. For those of us who are working with clients, participants, patients, looking at what resources they have too. And are we asking for something that they may not be ready to or may have a different plan for? So, you all may know some of this already, but what I have seen for myself and working with clients is that stress really lives in the gut a lot for people. So sometimes we have a lot of stomach issues that might come up. Sometimes there's hypertension, especially with chronic stress. We also may experience muscle soreness or tension, weight gain or loss, insomnia or oversleeping, sadness, confusion. So stress puts stress on the body. Stress is the hormonal energies and components that it takes to deal with it often cause physical manifestations. So it's important to realize how stress shows up for you within your body, and we'll do an exercise to help, if you don't already know, look at that. But that's also something to keep in mind, when, especially if you're a healthcare provider, when you're seeing patients and they're speaking of these things, are we actually assessing for levels of stress? And what's happening underneath, basically the stress is disrupting our normal bodily functions. So we want to find ways to have that stress where it's manageable, and so that we don't have a breakdown within our bodies. Oh, thank you, see? Oh, man. Okay, so talking about stress, compounded stress over time can be seen as Superwoman syndrome or Sojourner syndrome. So Sojourner syndrome was a term coined primarily to discuss African American women morbidity rates. And the theory was African American women in particular take on multiple caregiving roles. And therefore those multiple caregiving roles, those multiple expectations over time, coupled with the lack of time and feeling able to care for self, led to adverse health outcomes. So, Okay. All right, this was supposed to show up on the slide, but it did not. So if you have your phones, you can go to slido.com and put in the number 408-9453. Oh, it's showing up on the slide. And we can do a poll, or you can just raise your hand and let me know kind of what being a super person might look like, or what, if you've seen it either for yourself or someone else, what did it look like? 408-9453. The other one, I think it's already on there, but. Yeah. It doesn't put a poll. Okay, we won't worry about it. Sorry, y'all. Uh, we'll use Slido again. I don't know why the code didn't come up. But what has Superwoman, Superperson syndrome look like, either for yourself or people you work with or people in your life? Yep. Perfectionism, okay. Okay, not saying no. Not saying no. Feeling guilty for saying no. Working past work hours, okay? Always available. Always compare yourself to others, okay? Being positive about it.
It's like when you take on a particular task, you're like, appreciative or like happy to take it on, not like in a exhausted manner, but like, yes, I got, or I got you, like.
So you're kind of talking about that toxic positivity where it's not authentic, right? You really are tired, but you're saying, oh, this is good, I can do it, I got it. You're expected to be happy about it. Yep. Anything else? Feeling obligated. Ooh, okay, not complaining. Yeah. Burnt out.
Burnt out. Okay. It's okay.
Thank you.
I think you
So,
the makeup brush.
Is this problematic? Why? It takes a toll on you personally, so you're sacrificing yourself. And your time, okay. Okay, so that's the human aspect. We can only do so much, and eventually we do burn out. I heard you say something back. Were you? No, so you said it? Okay. Yes, ma'am.
Unfair expectations that are put on us by society and other people.
Yes, yes. So, go ahead.
I was just gonna say, like looking at her, she's built a resentment towards other people because of the hard work she's put in and being a perfectionist. She recognizes all the imperfections of other people, not performing the way that they're performing.
Yeah, so she is actually reinforcing what you're talking about in terms of the expectations of having to be perfect. And, I think it's called Sojourner Syndrome because, Sojourner Truth, it was at that time, this is who I needed to be. And when I work with my clients, I see that a lot. There's this idea of, I have to be this way, but when you ask why, there's not really much of an answer there. Yes.
No, you're good. When you're a perfectionist and there's people around you who do not meet the level of perfectionism that you strive for, you may feel that there is a necessity for you to be everywhere because you're the person who can get things done or you're the one who can do things well. And so you're like, see, I'm necessary. I have to do all these things. If not, they're not going to get done well.
So there's no trust. And I think that's the thing. I think when you're the designated super person, right, then other people say, well, you got it, right? You like doing these things. I don't want to do it. So you can take care of all of us.
eldest. It's just, that's the title. You are the decision maker. You have this task that you are responsible for completing.
Yep. Yeah, so culture dictates how we're supposed to show up in this world. And if we don't, then there's punishment for that. Anything else? Okay. So we know what might happen should we choose to continue that way, and why we might do that. What about if we chose to say no? What happens? Okay, so guilt comes in.
If you're always the person taking on these extra responsibilities, when you do say no, people are kind of like, what's going on with her? So they're not used to you saying no, so you may have to, deal with that as well.
So there may be some tension because you're actually disrupting the system. Okay? Yep.
And people don't realize that you have boundaries.
Yeah. Yeah, they're not used to you having boundaries, so it's kind of like, it's always interesting to me that people be like, of course I have boundaries, right? But now you get to have boundaries? This is new. So, yeah.
Do you really have boundaries if you never say no? Seriously, think
Yeah.
about it. Do you really have boundaries? Do you really have boundaries if you never say no, and that one time you say no and they're shocked? Do you really have boundaries?
Right.
You have not set up that boundary system that allows for you to be able to say no.
Right. Right. Yeah. So, yeah, there's the no boundaries or loose boundaries, right? Which basically often are no boundaries. And you're right. Once you start saying no, you're starting to implement boundaries, but you're right. You probably didn't have them in the first place there. And also, I should say, going into boundaries, sometimes we have stronger boundaries with certain people in certain environments, so it does differ. I may feel more comfortable saying no to a friend than I feel comfortable saying no to my boss, right? So it really differs on the person, and then some people, I can't say no to anyone. Good point, yes.
I was going to say, well, saying no and holding those boundaries is empowering, and sometimes you just have to stop and say, I'm no good for anyone else if I'm not taking care of myself. And I'm big on self-care. And when something starts to be too stressful or you feel like you're losing yourself within it, just have to stop and everything will be okay. And boundaries are very important throughout your work life and your personal life. So saying no, having those boundaries, sometimes we just feel like we have to do it all, but having a balanced life is just where we're gonna end up having a better self-care and to protect our physical and mental well-being. So.
Yeah. So if we say yes to everybody all the time, we're saying no to ourselves. And saying no to ourselves consistently also sends messages about our own sense of self-worth and how we show up in spaces. So we'll talk a little bit about the different manifestations of that, but you're absolutely right. If we start setting up boundaries, then we have the capacity to set up self-care activities, and then we can also move more towards wellness. Yes.
I was just going to say that what you said about having different boundaries for different people, like I supervise a team, and with my team, I feel like I have pretty good boundaries. Our workforce, our direct service workforce is very diverse, but our leadership is primarily straight white. And so the pressure that I feel to be a perfect, I place this pressure on myself to be perfect, and then if I behave in any other way, like showing like frustration or discomfort or anything like that, I feel like I'm slipping a little bit if I show those things, and then when they're called out, like, oh, you seem to be upset about this or something, then I feel like, oh, well, I can't do that. I can't show that emotion, because I need to make sure that I am thankful and doing my job 100%. I need to be the best so that I belong here. Yeah.
Thank you for sharing that. Yeah, and that's real. We have to prove ourselves, right? We are given the opportunity to be in leadership, so I have to show that I'm supposed to be here and I can do a good job. And that's a huge strain on someone all by itself. So is there anything else that comes up when thinking about if we choose to be the super person, or can we move towards being human?
For how long? About 3 months. And I had to continue kind of watching my job because I wasn't covered, and I care about my coworkers, and I continuously was watching my computer and calling and stuff like that while I was out on medical leave. And it's like, I know I went over my boundaries because I wasn't taking care of myself while I was not healing. And it's just like you have this weight on your shoulders, like you have to make sure everything is good. And then once you try and set up boundaries, people look at you like, well, you know, what's wrong with her? Is she upset about something? It's not that I'm upset, it's just I'm fed up. It's like, can you do your job so I can do my job? And so, you know, boundaries have gotten to be one of the top things that I and my coworker has been trying to set up, because some people, you do too much and then they expect you to do that. And then if you, like you say no, and then it's a problem for you to say no.
Yep. Thank you for sharing that. And I think one of the consequences of that, not only does it harm you, but it also reinforces that this is okay, right? Like, you're on medical leave. Technically, it's not legal, right? for them to expect you to do work while you're on medical leave. But we take on this attitude because, like you said, we don't want our clients, we don't want our staff, we don't want people to suffer. But then we're suffering, and also it gives the institution a pass. Yep. Right, right. Right, right.
And then there's a big mess that you come back to and
Right.
have to clean up, and it's
Yeah, it's not easy at all. It is another level of a sacrifice to say, okay, I am going to take this time to recover. And then it's the trust that the team is going to show up. But I get it's very difficult to decide to take that risk.
I think, like, just one thing I was thinking about just listening to all this is just like the inherent stress that probably a lot of us feel being BIPOC people working in this field, where the majority of our patients are probably BIPOC, and the majority of our leadership is probably white. And so it's like we have to function every day with these really inherent disparities in our system and huge power gradients in our system. And even those of us in leadership, like, that leadership feels incredibly fragile, like you were saying. And I wonder, like, I feel like it's more than self-care, right?
You're right.
It's like there are things here, there are a number of microaggressions that we probably face every single day that we do not have control over.
Yep.
So how do we continue to function at a level that's sustainable in this system and not be super people?
Yep.
And continue to not burn out, you know? Like,
Yeah.
it just feels more than just the things we can do for ourselves, but what the system has to do for us.
That's a great point. And also another challenge in doing this work as a person of color in a predominantly white leadership space. And I would say it's looking at where you can take risk. So my boss is the chief equity officer. And she's also a Black woman. And while she recognizes some of these microaggressions, she also feels like she has to be careful and how she goes about doing these things. So I think it's important when folks say we want racial equity that we actually call them out on it and name it and say this is what it is. I know for myself, I struggled with this feels like this might be something, but you know, what if I say something and they deny it or they gaslight me and all of that? No, we have to stop that. We have to say, this is what it is. Because what I've seen in spaces is folks are looking to us to tell them, or that it's told that they want to know when this is happening. But often, there's very little accountability for that. So I say all of that to say, you know the environment you work within, you know yourself. So thinking about the risk you're willing to take is important, but also we can name things with confidence and not have to say, well, you know, this is how this system works, and see what they do about it.
No, you're good. Something that I've been thinking since like everyone that's been talking in the past like 5 minutes is I feel like a lot of what I'm hearing and I've been thinking about is that it ties into like imposter syndrome, that we're like, oh, like we're clearly like everyone else around us who's above us, like they're not like us. Maybe I'm not supposed to be here. And so I have to be a super person because clearly I'm not supposed to be here if no one else here looks like me, which is obviously not true. But if the environment like is saying that, either literally or indirectly, like you feel like you got to do everything, or else then you're like, ooh, what if I'm not enough?
Yep. And we will talk about imposter syndrome today. So thank you for bringing that up.
I also, after listening, and kind of think about like within my like what I do for work in my coalition. As far as like being a leader and leading by example, like if you don't have boundaries and people like look up to you, you're doing this, and that, and you have family, you have your own IRLs, things like that, and even ancestral stress and things like that. But I realized just interpreting in my mind, like if I'm that strong of an impact for people to realize, okay, she's that it person that I go to, or like that's holding everything together, whatever the case may be, then if I start to lead by example of showing self-care and like, you know, leading, and then this is beyond just, oh, go get your nails done or take a day off, but just like even with the mind or healing or doing your own like shadow work, people might also see that and that you're leading by example, and be like, you know what, you know, the way they remain taking care of all these tasks is what I do. So I think as a leader, you can tell people it's okay to say no. It's okay to set boundaries. It's okay to take a day off and take care of yourself. That way you don't get burnt out, and then you end up regretting, or you know, even like showing bitterness towards your team or yourself or things like that. So I think that with leadership, there's a great responsibility that we don't often share or show or even know how to do. You know, I know it's a buzzword the last few years about self-care, what that looks like, but I think that if we take a different narrative on what leadership means and all, and like when you're like handing off tasks, that can be one of those things, like, you know, make sure you set boundaries as far as, you know what, I need days to take care of myself, that way I can show up and do the work, you know, the right way. And so if everyone's healthy all around, we can, you know, like take on, you know, homelessness or whatever the case may be, and no one feels like a hierarchy. So I just think that's like something that we can start, like shift what these words mean, and you know, that's, for me, that's like the journey I'm on. So
Yeah. Oh, okay. You said a lot of great things there. I'm going to try to paraphrase. First off, this modeling, right? You were talking about how we frame narratives, right? So we're going to talk about narrative work, but I'm glad that you're already talking about this. If we look at being someone who sets boundaries, that's modeling. And if one person does it, it's, oh, well, they may be weird, like something's wrong with them. But if other people start doing it, then that can become a norm. And then maybe we're not feeling like we need to call when we're on medical leave and check in and all of that. So there is power in modeling. And yes, you're taking a risk, but there is potential that it'll catch on with other people who feel like they have to be sacrificing themselves all the time too. The other thing that you said, in terms of doing like shadow work and things of that nature, if we're doing inner work, that's part of self-care. So if I'm doing that work, even if I'm not yet at the point where I'm setting those boundaries, I can still show something different. And so I think it's important for everyone to figure out for ourselves, where do we start? Where do we want to start? Maybe today I'm not going to say no to everybody all the time. That's okay. In fact, if you don't know why you're saying no, it's probably best you not go there immediately, right? You have to determine the meaning for what you're doing on your wellness journey for yourself. So thank you for that. Yes.
Listening to everybody speak and it's just reflecting on a lot of times, as like BIPOC, there's a culture of like having to be exceptional to navigate these spaces that are predominantly white. And then when you are starting to get into the leadership and like doing this work, there's also navigating a culture of mediocrity that is like supposed to be okay.
Yeah.
So I think that like becomes a very direct conflict because like sometimes I'm like, okay, they're setting their boundaries and they're not, that's cool, but it's also like how to navigate those spaces in that way because I've been having to be exceptional to do all this point. Not, you know, I'm not hyping myself up about nothing, but you know what I mean?
Yeah.
Like I think other people could say like you have to, just like navigating those kind of two worlds is
That's
really
a great point. And to that, I would say, I think it's important to know why you do things, right? So I may say, okay, I'm taking this work call, or I'm going to talk about this situation for a bit because this is what I'm doing. But it's time limited, and that is what I'm okay with. I'm not going to allow it to go beyond that. So I think you can still set boundaries and say, I still have for myself this value of, I want things to be excellent, I want to do well, but it doesn't have to be perfect, and I'm not going to allow it to take over my entire life either. Does that make sense? Perfect.
What we do, a lot of what everybody is saying, we're all taking this home to our families. So a lot of the stress that we have at work, it goes home with our families and it causes conflict with, you know, I mean, sometimes you might have a bad day and you just want to go home and sit down and talk, but you can't sit down and just drink a cup of coffee because you got to take care of the kids, your husband is hounding you, whatever the case may be, but then you have that double stress because now you have all this bull from work and now you got to come home and try and level it out at home. And it's like, sometimes it gets hard because you try not to bring it home, but you're gonna bring it home regardless, you know?
Yeah, so there's the acknowledgement as humans, we can't just automatically shut it off. Something that I found helpful when I worked out in the field was before I went home, I would do something for myself. That was kind of my buffer of, okay, I'm gonna process what I need because once I hit that door, I'm dealing with whatever's going on in my house. And I have to be fair to the people who are in my home too. So if you have space, I sometimes recommend thinking about how can I ground myself prior to getting into the home? How can I do something for me so that I allow my mind to transition?
I don't know if you're able to do it. My big thing, the way I ground myself, and my family knows, I sit in the car for 10 minutes.
Yep.
When I get home, I literally, no one comes out the door, no one leaves out the front door, but I will literally sit in my driveway, in my car for like 10, 15 minutes, however long it takes for me to center myself before I go in that door, because I know if I go in that door, it's going to be, Mom, did you do this, or Mom, did you do this, or Hon, did you do this, or Hon, did you do that?
There you go. Yeah. And it sounds like you've already established that boundary because they don't go run into the car. So yeah. Yeah, and it benefits them too, right? Because they know once you come in, then you have the space for them. So I love that. Any other comments, questions on this? All right. Okay, so we're going to go into briefly talking about burnout. So there are stages to burnout, and the hope is you'll notice what's going on early on. I think what I've seen happen is that folks will know when they're really burnt out. But it's hard to figure out when it started. And so what I work on with my clients on, and what I try to work on with myself as well, is recognizing where I am. So stress levels, recognizing what's happening in my body. Burnout, recognizing where I may feel it. So burnout doesn't just happen at work. Burnout can happen in relationships. Burnout can happen at home. So I try to keep that in mind as to where I may be being stretched a little too thin. And then I look at these stages. So honeymoon stage. This typically happens when you start a new role, especially if you get a new supervisor leadership position and, you know, you're the new one, you want to prove yourself. This is where we can take on a lot of work, where we want to show that we're excellent and we're the one for the job and we can change the world. And that feels good. We have high energy. That's also where we kind of, our expectations for the people we're working for too can look a little different, right? So I remember when I started working with my first supervisor that was a person of color in a high position, and I was excited. I was like, we're gonna change the system, we got this. But then I was quickly disappointed because that person did not show up in the way I thought they were going to. And so I had to learn to adjust my expectations there. So with the honeymoon period, I think it's important to reflect and understand it's great to be excited. And we want to use that energy, but we also want to maintain that reality will set in and we want to have energy to go throughout the long run with it. So honeymoon stage passes, we start experiencing slight levels of stress. So we may be getting calls after work, but we're like, it's okay, it's not as many, you know. But we start to see a loosening of boundaries at this point. And we might not notice what's happening within our bodies, we just may know this is not what I'm used to. Then we move on to chronic stress, which is what we talked about a little bit earlier. So this is not only do I have to do this for work, but I also have stuff going on in my house. And I also need to schedule these appointments. And, you know, and so it's starting to stack, and we're feeling it. But it's also kind of like, well, we'll just have to figure it out eventually. And throughout this, we typically still keep pushing. Rarely do we pause here. We say, okay, we know it's a lot, but now we really got to work because it's gotten to be too much. Then we move to slight burnout, where I'm tired. I don't feel like I can do everything I need to do. I'm disappointed in myself because I should be able to do all of these things. I'm disappointed in my team for not showing up. You may be upset with clients for not doing things that you feel like they should be doing. And so sometimes that can lead to habitual burnout, which can look like being irritable with a lot of folks. It could be clients, it could be staff, it could be anyone. Just feeling irritable because perhaps you're frustrated with yourself a bit as well. But at this point, I don't have anything left. And this is commonly where we see people say, start looking for new jobs, or say, maybe I should leave this relationship, or say, maybe this isn't the field of work I should be in. And for me, what I've learned is if we can start to say, what can I lay down much earlier, then we have more space to really process what's happening. And for some clients, I've seen where they did need to leave that position. And they took it as, yeah, I got to this point and I wish I hadn't had to go through all this, but I recognize now I know I have to go. And for some other folks, it's, I don't necessarily need to leave this position, but I need to have boundaries. And I need to know that I have support. And so with those folks, it's working on how do we develop that network of support. In some spaces, you may not be able to. And so then that becomes the question of, do I stay? Do I go? Any questions on this? Okay, so we're going to talk about the brighter end of the other spectrum on here in terms of wellness. And I really don't understand why I don't see my scan. Okay, see, this is me being very human. I don't have my QR code here, but you all are chatty. So let me know what gets in the way of your wellness, if anything. Time. Work. Ooh, lack of sleep. Yeah. Me. Yeah.
Doing yoga.
Huh? Do yoga? So that's how you do wellness? Okay, got you. Okay. Anything else get in the way of your wellness? Lack of support. Mm-hmm. Money? Yep. Guilt. What, can you speak more to that?
Yeah, so there's like a feeling of guilt if you're doing something for yourself and you feel like, I know that my staff is texting me even though it's like the weekend or like Sunday afternoon or something, calling out or, and so when I don't answer after an hour because I'm doing something for me, there's like weird guilt that happens. I don't know.
Yeah, I think that I see a few nods. That happens quite often. I can remember when I worked on a CST team, that was something that came up a lot. If a client called me after hours, if I didn't answer, what's going to happen to them? And it can feel really bad. You can feel really bad about it. Anything else?
It comes to everyone else, but when it comes to me, I'm not very patient. So even with like wellness, I hold healing circles on Thursdays, but like in my mind, as we're talking and I'm like doing it, I'm also writing notes like, okay, I have to get this done while I'm doing the grounding work for everyone else and creating those prompts. But in my mind, I'm like, I still have things to do after this. Like, so I'm not patient myself, which I see as a journey because even though I'm not really on that path, it doesn't mean that I can't still like bring people up with me as I go on. So yeah, I have so much patience for everyone, but when it comes to my own wellness, I'm just like, okay, I got like 20 minutes to do this, do that, and then I gotta get out and help people, for me, it goes back to if I want change, I have to be the change. So, I hold myself really high to that, even though I believe in healing and wellness, but I just still feel like that guilt thing is like high because I have so much life and so much to give, but yeah, it's a patient thing for me.
Yeah, the healer heal thyself comes to mind there. I remember when I started out with my practice, it was self-compassion, telling all my clients, everyone has self-compassion. And it took me a while to actually integrate that for myself. And you know, even now I'll talk to folks and I'll be like, yeah, I need to do that. And it is creating a practice of checking in with yourself and saying, okay, how do I give myself patience, show myself patience, and not feel like I have to put myself to the side and help other people heal, because you need to build up that energy to help people heal. So, anything else? Yes.
There's like two parts, like what you're saying, or it's like I feel like the thing that gets in the way of my wellness sometimes is the people around me, both in like a positive way where I'm like focused on helping them heal and like achieve wellness, but then in another way, it's like dependent on the people that I'm surrounded by, they may be not an encouraging like entity when it comes to my wellness. They may like encourage not the greatest things that I should be doing with my time or how I should be focused on myself. And it's honestly just like being around better people who are going to like help you get towards wellness.
Yes, that is a great point. So we often become what is reinforced. So if I'm trying to work on self-compassion, but I'm around people who, A, don't practice self-compassion themselves, and also might not show compassion towards me, then it's going to be very hard to reinforce that practice. So it's really important, especially when we're getting started in doing that work, that we have people who are able to model that for us. And sometimes it is, I may have to change my circle a little bit.
I think also you have to change some of the other inputs that you're getting, social media feeds and things like that, because that's that vacuum. And so you may have some people around you who may be pushing back on that, but if you're reinforcing it through other media types of things, it does the same thing.
Yes, yes.
And it feeds into that private space that voice gets magnified.
Yes, yes. So the reason why we chose to do the Galaxy Gallery was for that purpose. We want to reinforce certain messages. And sometimes you're right. Sometimes we have to be around certain people for whatever reason, and we can't change anybody. But we can focus, change what we're looking at and what we're allowing to nourish ourselves and do that inner work. Anything else? Yes, no problem.
Energy is real, and we can sometimes, without even speaking, people are attracted to our energy. So if you are that fun-loving person that's healing and you're holding yourself up to certain things, even if you're dealing with your own things, it's people can like see that you're a good person and they feed off of that, and that also like contributes to how people perceive you, and how you like, say for example, I said the patience thing, like people see that, oh, she's patient, like I'm gonna kind of put my stuff on her, and like trauma or whatever, and then that's the way I put myself out there, more people are gonna come onto that, and so I think even energy is another way that ties into wellness, or vice versa, because sometimes I'm like, why do I always get like the sad people? I'm like happy, but they see the energy that's like a healing aspect, and so that's why certain people keep coming to my life, and that cycle, continues itself too. So I just want to, as a spiritual person, bring in that energy piece too.
Yeah, somehow people know who they can go to for stuff. Yep, exactly. Go ahead.
Just one quick comment. Sometimes we have to create our wellness with our staff, those that we oversee. And I tend to do it. We have staff meetings. I live in Seattle and it rains all the time, but we try to get outside. We have our staff meetings outside. We walk. When we're stressed, I'm like, come on, we're going to the park. And so we have to sometimes self-induce that, and we have to create it. And I probably create it better for my staff than I do myself, but I'm learning that, so.
That is a great point, and I was actually going to talk about that in terms of for clients too. Like, I was at a training a few weeks ago, and they were talking about our physical spaces, where we're meeting clients. is that empowering spaces? Are those calming spaces? And are we being intentional about that? Sometimes we don't have a lot of control around that, but if we can do things that go out, like being outside, that does help us heal. So that's great that you can do that with your staff. And the other part about the energy piece, right? So if I'm tired and I'm meeting with a client, they feel that too. So something else to consider when we're thinking about should we take on everything is, even if you don't say it, they may know that you're not practicing boundaries, but you're telling them to do it, right? You're not practicing self-compassion, but you're telling them to do it. Because it does show, whether we tell them or not. Anything else? Yes.
I'd say productivity expectations gets in the way of my wellness because I'm a billable provider and I can't go for walks, you know, only on my lunch hour. And like there'll be times where they'll ask to do something mandatory during the lunch hour. And I kind of look at them like, okay, when's my break? You know,
Right,
and
right.
so to be able to hold on to that boundary, and that is the way our healthcare system is, and that's capitalism, and we're dealing with people that are oppressed, and there's always going to be a need. So the only thing I can control is, you know, when I'm able to have some time in my schedule, and that's been a change over the years. There was a time we had no time for paperwork. Now we got an hour, which is
So much.
I know, but we had it, and then it was gone, and then it came back. And so just the demands of the job and productivity, and that's why supremacy, right? That's how we're measured, but we're dealing with people, and we're dealing with
Yes.
people who have a lot of, I'm a therapist, so there's a lot of emotions. But how do you take care of the therapist? And I've seen a lot of people come and go simply because of that productivity expectation that waxes and wanes in our field.
Yep. Yep.
Yeah.
Because it's money. It's still money. That is a great point. I hope y'all forgot who I said I work for. But there was a certain organization that decided to do a wellness training, and the trainer talked about productivity. And that broke my heart because productivity, yes. Oh, thank you. Thank you. Productivity to me, I get it, right? We have to work within a system to do certain things. But when you highlight it as that has to be my sense of wellness and you frame it that way, to me that feels like what you were saying. That's supremacy, that's colonialism. And it's not right. And for me, I take it as how do I define productivity for myself? I did used to work in an organization where we had to have billable hours. And part of it was I had to let leadership know, you want these billable hours, but also, first of all, realistic expectations. Sometimes I can't find people. So I'm probably not going to make your productivity all the time. But also, even if I'm able to, if I burn out and leave, and we know, especially in our field, folks are leaving, then maybe it's your problem with the whole terminology and focus on productivity. So thank you for highlighting that. All right, we got like 2 minutes before the break. Is there anything else? Okay. So we can go ahead and go to the break.